Christine Nambatya is a nurse in charge of the intensive care unit at Kampala Hospital. Nambatya is also a wife and a mother of a 1 year and 7-month-old breastfeeding child.
In the ICU, our main role is to try and support those organs to take them back to their normal function. But it has been extremely challenging with COVID-19. You battle every day to try and get a patient out, to try and get a success story. But even those are not coming easy.
Shamim Nareiso is a service personnel at the same hospital. Her role is to take orders for food and drinks from COVID-19 patients and serve them. She's also a breastfeeding mother of a 4-month-old baby. Following the lockdown, Shamim had to leave her home with her baby and get accommodation near the hospital to continue providing her services to the patients.
And the challenge I'm getting, working from patients, then I come back to breastfeed the baby. That contact between the baby and me, I'm not sure if I'm 100% safe to be with the baby.
She has to breastfeed her baby 4 times a day. She does so by getting short breaks from the hospital.
I get out at 6 or at 6:30. Then I rush, I get orders for breakfast for my patients. I serve at around 8:30 or 9. Then I come back, I check on the baby. I go back, I pick orders for lunch. Then I come, after picking orders for lunch, it will be like around 11, I come back, I breastfeed. So that hour from 11 to 2, I be busy serving lunch. So I come back at 2:30, I breastfeed, I go back. So I come back at around 4, I breastfeed, I go back for supper orders.
Nambatya leaves her 1 year and 7 months baby at home and reunites with the family in the evening. Both mothers try to protect themselves and their family members from contracting the virus.
If I have a lot of time, I first sanitize myself at work, then I come back here where the baby is, I shower, I clean myself everywhere, then I breastfeed the baby.
Because I have a baby, sometimes you come in and the baby is right at the door waiting. You have to try and dodge them, first take a bath, and try to hope that all will be well.
Nambatya's husband had some reservations about her risky job, but the profession demands that she cannot surrender.
But I'm a nurse. I took an oath and I'm in charge of an intensive care unit. This is not the time for me to back out for anything. I have to work. If we stay home and don't come to hospital, who is going to take care of the sick? So we have to take in the risk.
The death toll during the second wave has been so high and has not spared health workers. This is another reason for Nambatya to worry.
Contagious nature of the COVID-19. You as a health worker, when you're moving in, you're worried. Will I contract the COVID-19? Will I take it back to my loved ones? You're worried. And because we've seen doctors die, so we've seen nurses die, you're not sure if I contract this, how is it going to end for me?
Also, because the two create rapport with the patients, they get drained when a patient dies.
Especially in the ICU, the ratio of nurse to patient is 1-on-1. And every day you come, 1 patient has passed, 2 patients have passed. It's really draining. You have
first picking the orders. You pick the orders, the same person who has ordered, going back, you find the patient is very ill, or the patient has passed on. So you get worried. You feel like you are not the same.
Nambatya and Shamim rely on protective wear and observing SOPs to stay safe, much as they have direct contact with patients. The international health standards recommend any health worker to wear the PPE for only 4 hours. However, this is practically impossible at the moment in most hospitals in Uganda.
ICU is a critical care, is a skill. You can't have so many critical care nurses. So we can't afford that of donning in for 4 hours, get out, take a break, and the other team comes in. So we stretch. You stretch for 12 hours in that PPE. It is very draining.
Nambatya also faces the challenge of getting back home every day during curfew.
People who don't drive are finding it very hard to get to hospital. When they sit on borders, they are hit. And then you have to work. So people are coming in, leaving your home on Monday, and you come and stay in the hospital up to Sunday when you're able to get transport to go back.
I really ask if they can support private facilities when it comes to PPEs. How the government can support us, but I was looking at transport, maybe availing buses for institutions, the private hospitals.
Patrick Senyondo, NTV.